Hi, my name is David Emerson. I'm a long-term myeloma survivor, myeloma cancer coach, and director of People Beating Cancer. Welcome to the vlog post about prognosis for the young myeloma patient, specifically the diagnostic criteria for the newly diagnosed patient. The main challenge providing prognosis for the multiple myeloma patient. First, let me give you the specific technical definition of the word prognosis, or the term prognosis. A prognosis is the likely outcome or course of a disease, the chance of recovery or recurrence. Now, understanding that, the challenge with multiple myeloma is that the average prognosis or prognoses across, let's say, 100 patients is varied. I know of patients who have undergone remission relapse within a year or two, reach end stage. At the same time, there are a growing number of patients these days who remission relapse over 8-10 years, sometimes even 15 or 20 years. At the same time, managing short, long-term side effects is tricky. All to say, turning to your oncologist and saying, how long do I have, is difficult at best, misleading at worst. And let me provide another couple of statistics. 95% of newly diagnosed myeloma patients are advanced, stage 2 or 3. I believe the greatest thing one of the greatest things, accomplishments of modern myeloma care, is the ability to stabilize the advanced myeloma patient, even stage 3, with a high percentage of monoclonal proteins in your blood, let's say a lot of bone involvement, bone damage. You can stabilize your myeloma. The overall survival is another challenge. So first you stabilize, you heal, and then you see how long you can live. All to say, let me also mention diagnostic criteria. So the common phrase, CRAB, C-R-A-B, measures your diagnostic issues. C, calcium, R, renal kidney function, A, anemia, what kind of condition your blood is in, B, bone health. Bones, kidneys, blood, all important in the newly diagnosed myeloma patient. All to say, your prognosis depends on your CRAB criteria as well as your age. These days, it's more and more common for younger, relatively young myeloma patients in their 50s to be diagnosed. That's fundamentally different from the newly diagnosed patient in their 70s. There's a lot going on with a prognosis and diagnostic criteria for the newly diagnosed myeloma patient. All to say, scroll down the page, send a question or a comment, ask me. I'll talk about therapies, both conventional and non-conventional. We'll try to hone in on your prognosis. In the meantime, thanks for your time and attention, and be well.